This is the first full week for this session. Kicked off last week with 2 days, including a throne speech.
Right, and throne speeches are generally fairly watery gruel. In this particular case, it was very thin watery gruel, or watery thin gruel, whichever way you want to put it. Anyway, there wasn't much in the way of telegraphing what the government plans to do.
No, but even without a roadmap, I think the first 2 days last week showed us that healthcare is going to continue to be the predominant issue. The Tory health critic Eddie Orrell was thrown out of the first question period for heckling the health minister. The province has signaled that long-term care needs better attention because they recently appointed a panel to review it. The number of patients without a doctor in this province continues to climb. And the two people primarily responsible for physician recruitment have stepped down from their jobs recently.
And the interesting thing is the NDP, back in the Darrell Dexter days, rode a wave of support for seniors care, did very well with that. Obviously, Gary Burrell would like a win too.
Yeah, and I think that it's going to become incumbent on the government during this session to show some tangible gains, some tangible efforts to improve healthcare. We're hearing that in the next week or two there could be a significant healthcare announcement, and I think it's going to take something like that to show people who aren't happy with healthcare that the government is not just listening, but it is taking very real and measurable steps.
Absolutely. I think the Premier and his team understand that simply saying we're working on it, be patient, is wearing thin.